Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, a top 10 ranking for the School of Medicine from a national news organization. But first, the effort to address vaccine hesitancy in underserved minority communities, specifically among African Americans and Latinos.
There are concerns related to the speed with which they've been developed, to have all of the safety parameters that we normally follow, have those been respected. You know, up until now, when vaccines have become available, specific populations haven't been targeted in this way. And so there is suspicion around that.
In the age of social media, Dr. Tapia says the concerns are understandable, but misguided due to misconceptions and misinformation.
There are theories such as that people are being microchipped through vaccines. There are concerns about long-term effects on fertility.
The CDC is leading the way with fact-based educational messaging focusing on the importance of getting everyone vaccinated. Working with organizations such as Casa de Maryland in Prince George's County, the School of Medicine is working to involve and educate minority communities. Dr. Sandra Quezada reached out to the Latino community on social media, speaking in both Spanish and English.
We have to remember that COVID-19 is a serious disease. It causes critical illness. It can cause death. And those of us who are Latinos, who are Black and indigenous communities, we've been impacted worse than other communities. We know and have to recognize we have suffered more infections, more death and mortality than other groups. This is our opportunity to protect not only ourselves, but to protect our loved ones and our communities.
With the infection rate still high, achieving vaccine acceptance and confidence is critically important, especially for minority communities.
Hopefully, if we all do our part and come together, get vaccinated, then maybe we can get back to a place where we can be together again and share a hug, share a high five, spend time together the way we really want to.
In U.S. News and World Report's rankings of the best medical schools, the University of Maryland School of Medicine has achieved its highest rankings ever. For the first time, the School of Medicine ranks in the top 10 among 90 public medical schools. The School of Medicine jumped from 34th to 27th among all 188 medical schools, placing it in the top 20%. In 2006, the School of Medicine ranked 42nd. That ranking has risen steadily, along with research funding, MCAT scores, acceptance rates, and overall reputation.
I'm delighted with the most recent U.S. News and World Report ranking, but I think what excites me most is the fact that this is really a public affirmation of what we all knew was happening. Our faculty are extraordinary, but I think equally impressive is the leadership, the chairs and the directors who have stayed focused, they've stayed resilient, but they've really emphasized very much the importance of discovery-based medicine and how investment in research can elevate the quality of care that we provide our patients and the education of our students. And this eventuates in the kind of high ranking that you're seeing. So I want to affirm the faculty for what they've done. I want to congratulate our leaders. This result, this ranking, is a direct result of their hard work, their focus, and the extraordinary effort over the years.
It's been a year since Governor Hogan helped launch the Clinical Center for Adults with Neurodevelopmental Disabilities and the Tuberous Sclerosis Complex Center of Maryland. They are the only treatment centers in Maryland for adults with autism, epilepsy, tuberous sclerosis complex, and other neurodevelopmental conditions.
Most of the care that we have here in the state and frankly in the United States, focusing on autism spectrum disorder really is based on the pediatric population, the pediatric age groups. And what I've learned over many years of practice is that once patients get to 18 to 21, after those ages, the resources, physicians, places for care, infrastructure, really are just not available. And so my specialty is adults who have autism, but particularly autism and epilepsy and intellectual disability. So we really don't spend a lot of time caring for individuals who are very high functioning, because it's not really the mission of our program. Rather, we're looking at the individuals who are really battling major social challenges, behavioral challenges, severe epilepsy, intellectual disabilities.
According to the CDC, 1 in 50 children in Maryland is diagnosed with autism, and many will face a lack of clinical support when they age out of pediatric programs.
The one thing that I've learned this year, and it's been an amazing year, it really has, just meeting people in their homes by telemedicine, is that patients just and their families just don't know where to go after 18 or 21. And they literally, to a person, have said, I'm so glad we found you. We didn't know where to go next. And I'll be honest, we don't have a cure for autism right now. So it's not like I'm offering them a cure. I think really it's just a link. It's just someone to hold hands and to get through this together. We do a lot of investigation for potential therapeutics. We do help with the epilepsy. We do a lot of work to help control behavior so that other types of behavioral modifications can be done. But really, it's been a singular message that people have been so happy to be able to connect with us and at least have a place to go where they don't have to explain autism. They don't have to explain intellectual disability. We understand the diagnosis, and we can work closely with families.
That's Frontline News. I'm Larry Roberts. Thanks for joining us. I hope you'll join us again next time.